Hello, my name is Dr. Adnan Rehman. I am working as a Registrar Urology at King Edward Medical University, New Hospital, Lahore. I cleared my MRCS Part B examination from Royal College of Surgeons of Edinburgh in 2025. In this video, we are going to discuss about the colleges, different colleges that are conducting exam in Pakistan and overseas, fee structure, attempts, and what are the different types of stations, and then we have in the last we will discuss about the preparation material that are used for different stations. MRCS Part B examination is conducted by 4 colleges: Royal College of Surgeons of Edinburgh, Glasgow, England, and Ireland. If we talk about in Pakistan, the Royal College of Surgeons of Edinburgh is conducting exam 3 times a year in different cities: Lahore, Karachi, and Islamabad. And the one good news for the Pakistani candidate is that recently the Royal College of Surgeons of England and Glasgow, they have announced they will conduct the examination twice a year in Pakistan. And first time Royal College of Surgeons of England will conduct exam in June 2025. One more question the candidate asked about: from where they should give the MRCS Part B examination. As I said, this is the intercollegiate examination. You can give examination from any Royal College of Surgeons of you can give from Edinburgh, England, Glasgow, Ireland, as per your feasibility. Like the Pakistani candidate, we have some financial constraints, so we should give the exam. We prefer to give the exam in Pakistan, so we have option of Edinburgh, Glasgow, and England. Each college has same cut-off values and same passing rate. It doesn't matter from which college you give the Part B examination. But the thing is that from which college you give the Part B examination will be your final membership exams. Like we can give the Part A examination from any college, but the Royal College you give the exam of Part B will be your final medical membership examination. If you talk about the fees of the Royal College of Exam, it is same for every college. It is £1,132. It's around 450,000 Pakistani rupees. And how many attempts, the other question is that how many attempts are allowed. So there are 4 attempts that can be given for Part B examination, and after clearing your Part A examination, the Part A is valid up to 7 years, so you have to give your Part B examination within these 7 years. So we are allowed to give the Part B examination with 4 attempts. Usually mostly the people clear the exam with first and second attempts. Now we will discuss about the stations in detail. There are 2 different types of station: applied knowledge and communication segments. In Part A examination, we have to clear the exam as a combined, but in Part B examination, we have to clear each segment separately. Once candidate fail in the knowledge segment, he will not be declared pass in the communication or Part B examination. You have to clear the both segments separately. We will discuss in detail about the passing criteria and minimal passing marks in each segment. And now we will discuss the applied knowledge segment in detail. There are 8 stations in applied knowledge: 3 from the anatomy segment, 2 from the pathology segment, and 3 from the critical care segments. These are 8 stations in the applied knowledge segment. In the communication, we have 9 stations: 3 from examination, 2 from history, 2 from procedure skills, and 2 from the communication skills. And you have 20 minutes each for each station. 1 minute. We have 20 marks each for each station, and total is for applied knowledge segment is 160, and for the communication segment we have the 180 marks. There are 10 minutes allowed for each station. Now we will discuss applied knowledge segments in detail. There is 1 minute to read the scenario that will be pasted on the table or outside the stations. You are allowed to read the scenario within 1 minute. And when you enter the station, there are 9 minutes. And usually there are 10 to 20 questions, one-liner question. You have to answer all the questions. They have dedicated marks for each answer and question. And the good thing is that you can skip the answer. If you don't know, you can skip the question. If you don't know the answer, you can answer that question at the end of your station. If you have done very well with your knowledge segment, you can answer all these questions. I will discuss about the preparation material that is used. Usually the paper comes from that segment. As I told you, there are 9 stations in the communication segment: 3 from examination, 2 from history, 2 from procedure skills, and 2 from communication. We will discuss examination segment in details now. There are 3 examinations, and similarly we have 10 minutes for each station and 20 marks for each station. 1 minute is for read the scenario. 9 minutes is divided into 6 and 3 minutes. 6 minutes is to perform the examination. In this time period, you are not allowed to take history from the patient. There may be a real actor, there may be a real patient or actor. During these 6 minutes, the examiner will observe, will not ask any question. Once you completed your examination, your time is up. There are 3 minutes left. In these 3 minutes, the examiner will take viva, and that will be according to your examination station. And now we will discuss the history station. In history, there are 2 histories usually. The material used for history I will discuss later. 1 minute is to read the scenario, and 6 minutes is to take history from the patient, in which you have to complete the differential diagnosis, investigations, and management plans. And in the last 3 minutes, there will be a viva of your concern of your history station. That includes your differential diagnosis, your investigations, and your management plan. Usually there are 2 examiners in this station. One is observing and one is your actual examiner. For the procedure skills, the material used is Andrew Miller's. There are usually 2 stations, and there are usually around 8 to 10 stations from which the Royal Colleges usually take exams. They are repeating over the year for all the Royal Colleges. Now for the communication segment, last segment is the communication skills. There are 2 stations. One is the phone call to the consultant, and the other one is the counseling of the patient, counseling of patient, attendant, and anyone. There is 10 minutes before starting these stations. Specifically in this station, you have 10-minute segment before your actual station starts. When your actual station starts, there is a 1 minute to read the scenario. In call to the consultant, you have to read through the files. Usually there are 5 to 10 pages files. You have to summarize your case, and then you have to update about your consultant according to the scenario. And then there will be answer question according to your stations. In counseling the patient, usually we have to follow the SBAR formula. So these 2 stations, they are very easy looking, and they are very easy to catch the marks. As this exam is a postgraduate type exam, membership exam, so usually it is given by the candidate that have completed their intermediate modules or they are doing the surgical residency. So the time required for preparation is usually 4 to 6 months. With your job, you are doing the residency job from you're busy in the morning time, and you have times or you have available only for evening and nights. So you can prepare this exam with 4 to 6 months with your residency exam, with your residency continue. What are the material? The most important is the material. If you have selected the desired material, you can cram this. You can clear this exam with first attempt and with good grades marks. For the knowledge segment, we have the updated SLR notes, for which anatomy, pathology, and we clear the critical cares. These 3 segments will be clear from the updated SLR notes. He has very precisely summarized all the scenarios, so all the exams come from these updated SLR notes. And for history and examination, we have the visit notes. We have to clear our ambiguities from the history or from the visit notes about the history and examination. As I told before, for the procedure skill, we have to study from the Andrew Miller's. Andrew Miller is the procedure skill books. It's very precisely accurate. It's very accurately precise all about the procedure skills. And for communication, we have to different types of notes are available, which can be available in the hard drives and soft drive forms. These are the material which is usually used for clearing the MRCS Part B examination. Material is another thing. The most important thing which helps you in clearing the Part B examination is a practice and partner. As this is the viva type examination, so you don't have to write anything. You have to just perform and answer the question. So we Pakistanis, we are not very good with our communication skills. So we should have one partner from the start of day 1 of our preparation. So That will be a key point if you practice with your partner both the knowledge segment and communication segments. There are a lot of questions I think in your mind. There will be a lot of questions in your mind. You can answer. You can ask any question and you can comment below my videos. I will be available. I will try my best to answer all your questions. So best of luck for your examination.